I want to start this video by stating I am not a doctor, I'm not a physician, I'm not an MD, I'm not an ND, I'm not a DO, I'm not an RN, not an LPN, not a nurse practitioner, I'm not a nutritionist, not a dietitian, I'm nothing like this. This video does not constitute any form of medical advice. I am going to talk about some of the things I've done to help my autonomic dysfunction. I'm going to talk a little bit about what autonomic dysfunction is, and I'm going to start the video with neuroleptic malignant syndrome. Neuroleptic malignant syndrome is a rare and life-threatening reaction to the use of any kind of neuroleptic antipsychotic medication. I think that it might be a little less rare than people think it is. It causes a high fever and muscle stiffness. Symptoms include neuroleptic malignant syndrome, high fever, hyperthermia, stiff rigid muscles that can lead to eventual muscle breakdown, altered mental status, autonomic nervous system dysfunction, which is what I currently have as a diagnosis. Now, when this started with me, and this is what you have to understand, you're not going to notice this at first. People will think you're a hypochondriac. People will think you're crazy. After all, that's why you're on the neuroleptic medications, is because you're crazy, right? But the fact of the matter is, when I was 10 years old, I was prescribed a medication, Haldol, for anger issues. And people might go, well, Haldol's an antipsychotic. Yes, it is. But what happens is doctors, psychiatrists like to be very creative. More so, way more creative with medications than traditional doctors. Psychiatrists like to experiment. So they will give people, like I was given Haldol for a combination of anger outbursts and oppositional defiant disorder. Now, the Haldol caused a lot of these neuroleptic syndromes here, so I was given Haldol with Benadryl. The Benadryl didn't help, so I was given Haldol with Benadryl with hydroxyzine. That didn't help. So then I was given Haldol with Benadryl with hydroxyzine with Cogentin. And I still had the symptoms, but it was assumed that the behavioral effects that were supposed to be helping my behavior were more likely to help my behavior, and it was worth me being on it than it was, because what it is, it's all about managing the people. It's not about actually helping the mental health patient. It's about managing them, warehousing them, okay? So your autonomic nervous system regulates certain body processes such as blood pressure and your rate of breathing. Autonomic dysfunction leads to wide swings in blood pressure, excessive sweating, secondary hyperhidrosis, which is excessive secretion of saliva, so you'll drool on yourself. Neuroleptic malignant syndrome is potentially life-threatening and requires immediate medical attention. Although, when you get to the hospital, the emergency room staff doesn't usually know what's going on with you, so they will discharge you and you will be symptomatic. Now, the medication that I had this on the worst was Seroquel. I almost died on Seroquel a number of times. So why would you prescribe what neuropsychiatric prescription diagnoses, why would you prescribe neuroleptics, like antipsychotics? Well, for behavioral disturbances, dementia, bipolar disorder, depression, eating disorders, generalized anxiety disorder, geriatric agitation, insomnia, obsessive-compulsive disorder, personality disorders, post-traumatic stress disorder, schizoaffective disorder, schizophrenia, and related disorders. Which drugs cause neuroleptic syndrome? Okay, typical neuroleptic antipsychotic medications. Okay, these are a list of the medications here. Okay, antiemetic medications, meaning medications that keep you from puking. These are what is the difference between neuroleptic malignant syndrome and malignant hyperthermia? Malignant hyperthermia is a rare and severe reaction to general anesthesia drugs and muscle relaxants. Common symptoms include muscle rigidity, slow decreased reflexes, and changes in skin, including bluish discoloration or flushing. Okay, what is the difference between neuroleptic malignant syndrome and serotonin syndrome? Serotonin syndrome is caused by serotonergic agents such as antidepressants and amphetamines, antihistamines, and mood stabilizers. Serotonin syndrome, which also is a very common disorder, happens when there is too much serotonin in your body. Symptoms of serotonin syndrome include muscle rigidity, increased faster reflexes, diarrhea, sweating, muscle jerks, and altered mental state. High fever, which means hyperthermia, and muscle rigidity are usually less severe with serotonin syndrome than with neuromalignant syndrome. What does neuromalignant syndrome? What does neuroleptic malignant syndrome affect? Neuroleptic malignant syndrome can affect anyone taking neuroleptic medications. Although 2/3 of NMS cases are thought to occur within the first week of starting neuroleptic medications, the syndrome may happen at any time during treatment. How common is neuroleptic malignant syndrome? They're claiming it's this low. I don't think that from being on these drugs and seeing people on these drugs. I think it's a lot more common than people think. So what are the symptoms of neuroleptic malignant syndrome? Irregular heartbeat. Okay, something I've suffered from. Fast heart rate, tachycardia, something I suffer from. Rapid breathing, tachyapnea, something I suffer from occasionally. Muscle rigidity. Okay, altered, which is something I have suffered from and occasionally do. Altered mental status, which is something I've suffered from. High blood pressure or low blood pressure, which is something I suffer from. My blood pressure goes up and down and up and down and up and down. Excessive sweating. Now, this is also what happens when you develop when you develop autonomic dysfunction, which is caused by these medications. How do neuroleptics cause NMS? Neuroleptic malignant syndrome can happen from a single dose, increasing the dose or the same dose of a neuroleptic medication. Meaning if you're on it, it can just happen. How is neuroleptic malignant syndrome diagnosed? You're taking a neuroleptic medication or have suddenly stopped a drug, okay? You have severe muscle rigidity, which is causing muscle breakdown. You have a high fever. You have altered mental status, excessive or abnormal sweating, difficulty swallowing, incontinence, rapid heart rate, sudden inability to speak, elevated or frequent fluctuating blood pressure, leukocytosis, increased white blood cell count, elevated creatine, creatine phosphokinase due to muscle breakdown, slow or limited reflexes. What tests will be done to diagnose this? Comprehensive metabolic panel, urinalysis, how is neuroleptic malignant syndrome treated, blah, blah, blah. What are the risks of developing, blah, blah, blah. Okay, let me move on. Well, the prognosis is not the greatest, but let's move on. So if you end up surviving the neuroleptic malignant syndrome, you get what's called autonomic dysfunction. So the autonomic nervous system controls several basic functions. Autonomic dysfunction develops when the nerves of the ANS are damaged. What is the autonomic nervous system? What does it control? Well, it controls heart rate, body temperature, breathing rate, digestion, sensation. The autonomic nervous system includes the sympathetic autonomic nervous system and the parasympathetic autonomic nervous system. Blah, blah, blah. The main responsibility. What is autonomic dysfunction? Autonomic dysfunction develops when the nerves of the ANS are damaged. This condition is called autonomic neuropathy or dysautonomia. Autonomic dysfunction can range from mild to life-threatening. It can affect part of the ANS or the entire ANS. Sometimes the condition that caused problems are temporary and reversible. Others are chronic and long-term and may continue to worsen over time. Diabetes and Parkinson's disease are two examples of chronic conditions that can lead to autonomic dysfunction. Symptoms of autonomic dysfunction: dizziness and fainting. I've had that. Up on standing or orthostatic hypotension. I've had that. an inability to alter heart rate with exercise or exercise intolerance, sweating abnormalities, I've suffered from that, digestive difficulties, bloating, diarrhea, constipation, or difficulty swallowing. Now, there are a lot of people that are diagnosed with irritable bowel syndrome. What's interesting is irritable bowel syndrome, nobody really knows what causes it, interestingly enough, is technically the symptoms, some of the symptoms of dysautonomia. Urinary problems such as difficulty starting urination, incontinence, and incomplete emptying of the bladder. Sexual problems such as difficulty with ejaculation or maintaining an erection. Sexual problems in women such as vaginal dryness or difficulty having an orgasm. Vision problems such as blurry vision or an inability of the pupils to react to light quickly. Blah, blah, blah. Orthostatic intolerance is a condition whereby your body is affected by changes in position. An upright position triggers symptoms of dizziness, lightheadedness, nausea, sweating, and fainting. I've had that. Lying down improves the symptoms. Orthostatic hypotension is a type of orthostatic intolerance. Orthostatic hypotension occurs when your blood pressure drops significantly as you stand up. This can cause lightheadedness, fainting, and heart palpitations. Okay, now what happens in that situation is, in my heart palpitation situation, it would cause tachycardia, which would then shoot my blood pressure up. I've had blood pressures where the top number was over 200 and the bottom number was over 100, to the point where it was what's known as what's called a hypertensive crisis, because my heart was trying to make up for the hypotension. I didn't know that. I thought I was suffering from these ridiculously high blood pressures for no reason. It turned out that, from what my cardiologist said, it's actually my vascular system trying to make up for the hypotension by shooting my blood pressure up to the point where it's a hypertensive crisis. So other types of orthostatic intolerance due to autonomic dysfunction include orthostatic tachycardia, which is something I have, neurocardiogenic syncope or vasovagal syncope. I have suffered that. Types of autonomic dysfunction: postural orthostatic tachycardia syndrome, neurocardiogenic syncope, multiple system atrophy. You can read this on your own. Hereditary sensory and autonomic neuropathies, Holmes-Addy syndrome. Okay, so some diseases causing this neuropathy include uncontrolled high blood pressure, long-term heavy drinking, diabetes, autoimmune disorders. Parkinson's disease can cause orthostatic hypotension and other symptoms of ANS damage. How is autonomic dysfunction treated? Your doctor will treat autonomic dysfunction by addressing the symptoms, blah, 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 elevating the head, drinking enough fluids, adding salt to the diet, wearing compression stockings to prevent blood from pooling in the legs, changing positions slowly, coping and support. Depression can occur with autonomic dysfunction, blah, 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 Damage to the nerves of the ANS is often irreversible. Talk to your doctor if you have any symptoms of autonomic dysfunction. Okay, now remember, these antipsychotics can damage your nerves, so keep that in mind. So let me move on here. Effects of 4 atypical antipsychotics on autonomic nervous system and activity in schizophrenia. So, yeah, let's see here. The parasympathetic activity, blah, 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 ANS. We suggested among the antipsychotics examined, Respiridol, I don't know what that one is, blah, 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 and quetiapine, which is Seroquel, has the strongest effect on the central nervous system, which is not a good thing. It can cause autonomic dysfunction. You can read this on your own. It's about the delirium caused by Seroquel. So flavonoids are a potential benefit to neuropathy, okay? So numerous flavonoids have been demonstrated to be safe, natural alternative treatments against neuropathic pain, oxidative stress, and neuroinflammatory diseases. Mechanisms of neuropathic pain, blah, 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 blah. Okay, let's go down to the conclusion here. Okay, so what was discussed here was the effects of flavonoids in improving different neuropathic conditions and how flavonoids control diverse pain biomarkers in animal models. Okay, subsequently controlling their activity, flavonoids are strong allosteric modulators and may serve as valuable candidates in the management of neuropathy. Hence, it can be said that there is huge potential in flavonoids for the development of novel therapeutic agents. What about exercise training? Okay. So in this review, the recent scientific literature has been carefully analyzed in order to demonstrate the existence of a close relationship between physical training and anti-inflammatory and antioxidant effects on the autonomic nervous system. We know a lot about the benefits of exercise, but lack information about the correct mode, type, length, and frequency of exercise necessary to gain such benefits. The quality of low-volume exercise performed with high intensity has become more and more noteworthy, with many studies showcasing the comparable efficacies or efficiencies of high-intensity interval workouts and traditional training. The recommendations regarding moderate intensity exercise for people are 30 minutes a day, 5 days a week. For people with diseases like autonomic disorders, the training should be conducted under the supervision of Moderate exercise is recommended. This is why I think I found that physical therapy type exercise works the best for me. Okay. But mechanistic analysis of free radicals and antioxidants may be useful for physiotherapists and health professionals, particularly when comparing different exercise regimes in order to outline appropriate recommendations for physical exercise in health guidelines. Quercetin is just a magnificent substance. I started taking it for asthma. But a flavonoid on the brain, quercetin, is a potential therapeutic in central nervous system disorders. So what I take is 2 grams broken into 1 gram doses with 6 grams broken into 3 gram doses of vitamin C. So I take 1 gram of quercetin in the morning with 3 grams of vitamin C and my other supplements. And in the evening, I take another gram of quercetin with 3 grams of vitamin C. The vitamin C helps you absorb the quercetin. So quercetin is a safe, health protective, and common food ingredient that is easy to isolate either in pure, blah, 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 blah. And I do plan on going over this in depth with nutrition and exercise. However, it should be remembered that up until now, quercetin is used only as a diet supplement supporting health, not as a drug aiming to cure a particular illness. Although quercetin seems to be promising in alleviating different symptoms of diseases, as it is generally a highly reactive structure, and subsequently its biological activity is pronounced, clinical studies are essential to prove its efficacy, blah, blah, blah. An analysis of the available literature on the effect of quercetin in animal models allows us to conclude that active doses of quercetin were moderate, 10 to 30 milligrams per kilogram, or relatively high, indicating not very strong or even weak effect exerted by the compound. The preclinical blah, blah, quercetin is limited due to its low water solubility, and that's why you should also take it with fat, like take it with a meal. Many researchers recognize that although quercetin revealed remarkable effect, so high doses of pure quercetin revealed a remarkable effect. The exploration of novel drug formulations gives much hope, as quercetin is effective at much lower doses. Administration of quercetin in novel drug formulations leads to its much higher concentrations in the brain. One in vivo study utilized blah, 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 quercetin alone, Okay. Quercetin concentration in the brain, which was very different between the study group. Additionally, no toxicity of exosome quercetin complex towards different organs was noted. In another study, exosome quercetin complexes inhibited the activity of blah, 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 blah. Quercetin nanoparticle, needless to say, the more similar the study conditions, blah, blah, blah. okay? I mean, weaknesses, see furthermore. Okay, moving on. 2 weeks of taurine supplementation reverses endothelial dysfunction in young male type 1 diabetics. You can read this on your own. I'm going to move on. If you're getting muscle cramps or muscle spasms, you might need electrolytes. You can read this on your own. I do plan on doing a whole one on nutrition and exercise and autonomia, or dysautonomia. So this is about B vitamins, how B vitamins can help improve nerve health. You can read this on your own. I'm going to go over this more in depth on the video I do, which will be on nutrition and autonomic dysfunction. Vitamin C is involved in the physiology of the nervous system, including the support and structure of neurons, the processes of differentiation, maturation, neuronal survival, the synthesis of catecholamine, and modulation of neurotransmission. So I'm going to go into this more in depth in the video I make on nutrition and dysautonomia. And cocoa is another substance that is beneficial in neuropathy, especially diabetic neuropathy. And that's all for this video.